Good evening. I'm Nima and this is Forum Daily for Wednesday, February 1st. We begin the newscast tonight with a look at immigration and the labor market. Canada is already planning to increase immigration, but experts say it's not enough to fix the labor market. According to Statistics Canada, recent immigrants are less likely to see their skills and education utilized than Canadian-born workers. This while new and recent immigrants are overrepresented in certain industries, including transportation, warehousing, accommodation, and food services. Toronto immigration lawyer Sergio Carraz says government policies have created a mismatch between the particular skills that employers are looking for and the skills of immigrants being approved. Meanwhile, higher grocery prices are expected to hit stores across Canada as soon as a blackout on price increases over the holiday season comes to an end. Last fall, Loblaw Companies Limited said it would freeze prices on all its in-house no-name products until January 31st. This while Metro said it would hold prices of most private label and national brand products steady until February 5th. The lifting of the price freezes comes amid growing consumer outrage over soaring grocery prices in Canada and increasing scrutiny of strong profits by grocers. But grocery chains have argued that their food margins have remained flat and they are simply passing along higher supplier prices. All right, well, the Prime Minister says Quebecers are not racist as he stands by Amira El-Gawabi, Canada's new special representative on combating Islamophobia. He's facing pressure from a number of Quebec politicians to rescind her appointment because of comments she made in 2019. She previously referred to a majority of Quebecers who supported Bill 21 as also holding anti-Muslim views. She now says she is extremely sorry for the way her words have carried and how they hurt the people of Quebec. She says that she will listen carefully, and that's what dialogue is all about. On the East Coast, a new pilot project in Nova Scotia is expanding the scope of practice for some pharmacists. Health Minister Michelle Thompson says the $1 million project will be piloted in 12 pharmacies across the province. More locations are expected to be added in the spring. As of today, pharmacists in those piloted clinics will have dedicated time to treat patients for common illnesses, as well as be able to test, diagnose, and treat strep throat. To the other side of the country now, as Vancouver International Airport is reminding travelers that new rules around drug decriminalization in the province do not apply on its property. Across British Columbia, adults are now exempted from criminal charges for the personal possession of small amounts of certain illegal drugs. But the rules around decriminalization do not apply at airports or international borders. All right, well, meanwhile, the top doctor at BC's First Nations Health Authority says Indigenous people and especially women are dying from toxic drugs at disproportionately higher rates. Dr. Nell Wyman says illicit drugs are killing First Nations people at 5 times the rate of BC's general population. The underlying reasons are complex and include intergenerational trauma stemming from residential schools and the apprehension of Indigenous children for placement in government care. Dr. Wyman's remarks came on the day BC's chief coroner released data showing suspected drug toxicity claimed nearly 2,300 lives in BC last year. A longtime former CBC producer has died after a random daytime assault in Toronto's East End. The broadcaster says Michael Finley, who worked with the network for 31 years, died on Monday, a week after the attack. Toronto police say a man was allegedly assaulted and fell to the ground with serious injuries, and a male suspect is still at large. All right, well, this comes as police say Ontario reported roughly $5.4 million in losses to emergency scams last year. This is far more than any other province. Ontario Provincial Police and RCMP say the $9.2 million lost to emergency scams last year nationwide is 4 times higher than the year before. Ontario's reported emergency scam losses far outpace Alberta's $1.1 million and Quebec's $732,000 last year. Those emergency scams include grandparent scams. Now, this is where grifters cold call seniors claiming to be a grandchild, a family member, police officer, or lawyer, calling on behalf of a loved one who urgently needs money. Switching gears to a new online tool which has been helping thousands of people learn Ojibwe. The free online platform by Say It First was originally designed for school students. This was after a request from an Ontario First Nation leader 3 years ago. The goal of the tool is to help revive Ojibwe, an Indigenous language spoken in parts of Canada and the U.S. All right, stay with us. Forum Daily will be right back after the break. Up next, we'll take a look at COVID-19 in Canada in 2023. We're going to speak with Dr. Abhishek Raut from Appletree Medical Group, so stay tuned. As Canadians return to what appears to be a new normal following the peak of the pandemic, recent comments by the WHO chief remind us that the global health emergency is not over. On Monday, the head of the World Health Organization said there is no doubt that we're in a far better situation now than we were a year ago. But Director General Tedros Adhanom Ghebreyesus says COVID-19 remains a global health emergency. Now, that's despite an expert panel saying that the pandemic may be nearing a phase where higher levels of immunity can lower virus-related deaths. He's hoping that in the coming year, the world will transition to a new phase in which we reduce hospitalizations and deaths to the lowest possible level. Well, joining us now to give us more insight into the pandemic in Canada in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So where is Canada at when it comes to the severity of the pandemic, Dr. Raut?
Well, Canada is doing well comparatively. We have about 81% of our entire population vaccinated with 2 shots. Overall, every province is reporting a vaccination rate greater than 75%. And many of us are actually quite cautiously optimistic that even the new variant, which is the XBB.1.5, also known as Kraken, is actually not going to be as severe as we thought. We initially thought that it would cause reinfections in people and cause a cascade of cases that typically we would have seen in December, January of last year. But so far, the vaccinations and our immunity has been pretty effective in keeping our COVID cases and deaths low.
Sounds like some good news, Dr. Raut. Now, going back to what Dr. Ghebreyesus was pointing to, the 170,000 people who died around the world in connection to COVID, this was in the last 8 weeks. What do we know so far about the demographics associated with these deaths?
Yeah, so we certainly have seen surges in certain weeks of COVID-19 in a few other countries. As an example, we know that a study done by Peking University showed a significant amount of increased cases in China in the past few weeks as well. And what we saw in that model was that hospital in big cities where healthcare facilities are better and more easily accessible were crowded with COVID-19 patients. But I think the issue there was also the rural areas. So many elderly, sick, and disabled in the countryside are being left behind in terms of COVID treatment, and those do build up in the number of deaths that we are seeing just across the world as well.
So how many severe cases and deaths have we been seeing in Canada within this time period?
Right. So if we look at just our time period, let's say even in the last week or so, we've seen around 11,000 cases across the country and around 229 deaths, which is not in keeping what we would have seen as a trending average as well. So we haven't seen these huge increases as some other countries have.
All right, Dr. Raut. Now, as we say, we're in this new normal amid these severely reduced restrictions. How important is it for Canadians to still take these precautions to protect from COVID? And what would this look like within this new normalcy that we're living in?
Right. So I think as physicians, this is a very classical question we get with our patients, not just for COVID, but for anything. So if you have high blood pressure and you're put on a medication, the blood pressure is good. The question is, do I really need the pill? And the answer is yes, we still need these precautions here. The precautions we're taking have been very helpful in keeping our cases at bay, but it's still important that we continue these precautions. Now, what exactly are these general precautions? It's just making sure that you're getting your vaccines and boosters, staying away from others when you feel sick, and wearing a mask when you're vulnerable, or if you're going to be around vulnerable people. So basic precautions that are very helpful here.
All right, basic precautions, Dr. Raut. About a minute left here, but last year we talked a lot about the rise of other viruses that we saw in Canada, like RSV and the common flu. So where are we at when it comes to the risk associated with these viruses?
Okay, so maybe some more good news there, but cautiously. What we have seen is that when we look at the cases of RSV and we look at the influenza cases, we're seeing levels that we would expect pre-pandemically. We're not seeing these massive surges as yet. Now, granted, with a lot of mask wearing that we did in the past few years, the surge is definitely higher than what we saw in previous years, but certainly not pre-pandemically. So as long as we're able to maintain these levels, I think we're going to be okay.
All right, Dr. Raut, a quick 30 seconds left here, but if you could leave us with one message regarding safety in 2023, what would it be?
Okay, I think the social cost of sickness is really incalculable, and the prevention is, for the most part, the most important. So education is key. Vaccinate when you can, test when you can, and wear a mask when you can.
Dr. Raut, always great having you on Forum Daily. Thanks again for your time today.
Thanks so much for having me.
Stay with us. We'll be right back after the break, and we're going to be taking a look at Black History Month in Canada. This month is an opportunity to highlight the contributions, impact, and accomplishments of Black Canadians to their communities and to Canadian history. And this year's theme is Ours to Tell. We're going to be unpacking the significance of Black History Month with Dr. George Day up next. Stay with us. February 1st marks the first day of Black History Month in Canada. Black History Month is an opportunity to highlight the contributions, impact, and accomplishments of Black Canadians to their communities and to Canadian history. The theme for this year's Black History Month in Canada is Ours to Tell. It emphasizes the importance of the stories that Black Canadians tell of Canadian history and the contributions of the Black community in Canada. Joining us now to educate us about Black History Month in 2023 is Dr. George Day, an internationally renowned Canadian scholar on race and anti-racism studies. He's also currently a professor in the Social Justice Education Department at the Ontario Institute for Studies in Education at the University of Toronto. Dr. Day, welcome to Forum Daily.
Thank you. Thanks for having me.
Great to have you, sir. Now, can you tell us a little bit more about this year's theme, Ours to Tell, and what it means for education on Canadian Black history in particular?
Yeah, no, the theme of Ours to Tell, right, comes from the idea that we have to tell our stories. We need to retell our stories, given that for the most part, our stories have been told on our behalf. So we need to restory our lives to present the story, which is not just about struggles, but also resistance, desires, pleasures, achievements, contributions. And that's why it's so important for us to tell our stories, which have been missing from discussions around African or Black history. And one aspect of telling our stories is also to make the point that we're talking about history, which is 365 days of the year, not just 1 month. And we need to tell that story.
A very good point that we need to talk about this every day of the year. Now, there's been a lot of attention drawn to anti-Black racism down in America, but this also exists in Canada. So what do we know so far about the state of anti-Black racism in our country and whether it's improved?
No, it's still a problem. It's a global problem, and Canada is not immune to it. Anti-Black racism is an international problem, and I think we need to admit to it. You cannot solve a problem if you are silent about it, if you deny it. And I think we have to be very open about it. It's not just in the US, it's in Canada. And I'm not interested in whether we are moving forward to what extent. It is still a problem. We need to address it. That's how we should take it, so that we don't get into this sense of complacency that we think, oh, well, we are better off than it was, right? It's still a problem. And I think when we hear events in the US, we have to think about, are there comparable events that we can also talk about in Canada, in Canadian context? And there are, and we should be able to speak about that so that we don't juxtapose the US with Canada. Canada becomes the good and the US the bad. That doesn't solve the problem. The problem is that we must admit anti-Black racism is a problem. It's an international problem, and Canada is not immune to it.
A very good point. It is an international problem. All right, Dr. Day. So for some further perspective, can you tell us a little bit more about the unique challenges that Black Canadians face even today when it comes to opportunities, socioeconomic disadvantages, and their overall standing in this country?
Yeah, I think one of the challenges has to do with what I talked about, the denial, right? For example, when we look at, say, questions of enslavement, right? We talk about it as if Canada was immune to enslavement, right? Canada has a history of slavery that we need to talk about. But we also have to admit that there are challenges within our institutions, whether it's education, health, law, the police, the media. And I think it's very, very important to see that these are challenges that we all are responsible to address. And it's not just a problem of, say, Black, Indigenous, and racialized bodies. Anti-Black racism is a problem for everyone, Black, white, yellow, brown, whatever you call it.
And what are your thoughts on Canada's response so far to anti-Black racism in the country? Has it been a good response so far? Is there things that the government still needs to do?
There's more to be done. I think there's more to be done. I think when we look at our educational system, to what extent is our curriculum reflective of an African history which doesn't start with slavery, an African history that goes back to pre-enslavement, an African history that sees Africa beyond colonization, an African history that sees the continuing contributions of African and Black peoples throughout our history, the totality of our experience, the totality of our existence, not just a particular period. African history did not start with 1492. And I think we need to teach about African history pre-1492. What are some of the achievements, contributions that continue to this day to inform the present? And that's how we should look at it. So there's more work to be done.
Taiwan has scrambled fighter jets and put Navy ships and missile systems on alert. The move comes in response to nearby operations by 34 Chinese military aircraft and 9 warships. Taiwan's defense ministry says 20 Chinese aircraft crossed the central line in the Taiwan Strait, which has long been an unofficial buffer zone between the sides. China claims the self-governing island republic as its own territory to be taken by force if necessary. Most Taiwanese are opposed to coming under the control of China's authoritarian Communist Party. In the latest on the proposed expansion to the NATO military alliance, member country Turkey continues to stand its ground. Turkey's president has reaffirmed that Turkey won't allow Sweden to join the military alliance as long as it permits protests desecrating Islam's holy book. Turkey has been holding off approving Sweden and Finland's membership in the alliance. The Turkish government has been infuriated by a series of demonstrations in Stockholm. President Recep Tayyip Erdogan said Wednesday that Sweden shouldn't even bother trying to join as long as such protests continue. Sweden's prime minister on Tuesday denounced the activists as useful idiots for foreign powers who want to inflict harm on the Scandinavian country. Turning now to the ongoing unrest in Haiti. Jamaica's prime minister says his government is willing to send soldiers and police officers to the country. This is part of a proposed multinational security assistance deployment. The announcement comes a week after UN Special Envoy for Haiti, Helen Lalim, spoke on this. She said she hoped that the UN Security Council would deal positively with the pending request from Haiti's government for international armed forces. Her comments come despite the US and Canada showing no interest. Tyree Nichols was laid to rest today during his funeral in Memphis, Tennessee. The 29-year-old FedEx worker, who was father to a 4-year-old son, died last month after a violent arrest involving Memphis police. 5 police officers were fired and later charged with murder. Their specialized unit was also disbanded. The funeral was scheduled for this morning, but was delayed due to weather. Turning to the UK now, where the biggest day of industrial action in over a decade is happening. It's estimated that up to 500,000 workers walked off the job today across the country. This includes teachers, university staff, civil servants, border officials, and bus and train drivers. Months of strikes have disrupted the daily routines of Britons. This comes as a bitter dispute between unions and the government over pay and working conditions drags on. In the latest economic reading from the European Union, the annual inflation rate dipped for a 3rd straight month in January. While it provided some relief for consumers, it still leaves them facing higher prices. The European Union Statistics Agency says the consumer price index for the 20 countries that use the euro currency increased at an annual rate of 8.5% in January. Now, this is down from 9.2% in December. It's the first report on consumer prices with data from Croatia, which joined the Eurozone on January 1st. Inflation in Europe has now slowed from a record high of 10.6% in October, but food and energy prices remain the major factors driving inflation. Amid Russia's invasion of Ukraine, Latvia has threatened to boycott next year's Paris Olympics. The Latvian Olympic Committee president has said his country would not compete if the Olympics were to take place now with the participation of Russians and Belarusians. There has been criticism from governments of plans to let them compete, but the response from the National Olympic Committee has been muted. In major sporting news, Tom Brady has announced his retirement from football for the second time. The Tampa Bay Buccaneers quarterback released a video on social media today confirming the news, saying this time it's for good. Tom Brady won a record 7 Super Bowls with New England and Tampa. Now, this makes him the most successful quarterback in NFL history. And authorities in Western Australia are pleased to report that they've recovered a tiny but dangerous radioactive capsule. It fell off a truck while being transported along a 1,400-kilometer highway last month. One official says it was like finding a needle in a haystack. After 6 days of searching the entire length of the Great Northern Highway, the capsule, the size of a pea, was found south of Newman. Radiation emissions were detected by special equipment aboard a search vehicle traveling at 69 kilometers per hour. Portable equipment was then used to locate it 2 meters from the side of the road. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on our social media handles on Facebook, TikTok, Instagram, and Twitter. You can also watch all of our commentary programming, all our interviews as well on the News Forum YouTube channel. Thanks for joining us today on Forum Daily News, and we'll see you again next time. Take care, Canada.